Hi folks, this is Dr. Rob Cywes. I am the Carb Addiction Doc, and this video is going to be the first in a series of 5 videos that are all about the same topic. And it is about how dysfunctional and how diverted our thinking about the human body is with regards to cardiovascular disease and lipids, and how we've just taken this left turn and gotten bogged down in all the statin stuff, all the medications, and we really don't understand what is happening physiologically in the body that has caused this left turn in our narrative. So this video is going to be an overview, and I was doing an interview, a podcast, with a guy by the name of Dr. FORD BREWER. Very supportive of him. He's doing great work out there, but he is still quite invested in statins as a therapeutic modality. And once you're talking about statins, once you start talking about a lot of these products, which may or may not have value, and certainly I look at the liability versus the value. I talk a lot about aspirins. All of these things, all of these drugs, all of these strategies are designed to treat inflammation that has already occurred. Inflammation has already occurred, so the body is pro-inflammatory, the body is inflamed, the vascular system is inflamed, and now we got to push a narrative of a whole bunch of drugs and a whole bunch of things to treat that inflammation. But we don't look at, I'm going to treat the inflammation, we're not going to measure the inflammation. We use numbers that supposedly correlate with inflammation. So we look at LDL, we look at cholesterol, and we assume that those correlate with inflammation. And then we've got all these drugs that block pathways, block enzymes. But what we haven't done is gone back and looked at what is inflammation, what are the triggers of inflammation, how can I reduce inflammation? And if my body is in an anti-inflammatory state, when the firemen are working well and there's not a lot of arsonists in my body, then I don't need all of these anti-inflammatory strategies or all of these strategies to deal with inflammation. And the functional medicine doctors have a whole bunch of things that they throw at you to reduce inflammation in any body space. We're going to use antibiotics in the gut. We're going to use all these gut things. We're going to use niacin and NAC and vitamin C and all these things. And we're going to use statins, and we're going to use lipid-lowering agents and PCSK9 inhibitors. And we're going to use fish oil, and which I kind of like, but we're going to use all these things to reduce inflammation. Why don't we talk about and teach and educate folks about how to reduce the cause of the inflammation? So folks, this video is about inflammation, and the commonest cause of inflammation is hyperglycemia. It isn't glucose by itself, it's elevated levels of blood sugar, and the elevated blood sugar is either too much sugar that we've consumed that's spilling over into the bloodstream, or insulin resistance where sugar can't get into the cells and the cells are running at an energy deficit. Well, that hyperglycemia in the blood vessels causes inflammation of the blood vessels. How do we reduce the demand if you're insulin resistant? One of the ways to do that, and this is the whole premise of a ketogenic diet, is to eat fat to help your liver to produce ketones. But sometimes if we're running a little high on sugar and low energy in our cells, the easiest way to boost that is to take some ketones. And this ketone IQ is an excellent, instant anti-inflammatory product because it reduces your cellular demand for sugar. So your liver is not pumping sugar into your blood vessels when the blood sugar is already high, because it recognizes, hey, my cells have got enough energy. So using ketone IQ as a way to decrease energy demand from your cells is an excellent hack if you are not diabetic, but you have insulin resistance. Or even in our carnivore patients who are insulin suppressed, they can't clear that sugar that was made from protein. Exogenous ketones are an excellent bump. Now, you may be in ketosis from time to time, but there are times when your ketone levels come down. We've seen that on a continuous ketone monitor. That's where you can use exogenous ketones as a hack to give yourself the cells energy so that they don't demand sugar from the liver. And that, folks, reduces vascular inflammation and intracellular fatigue and inflammation. So in response to my interview that I with Ford Brewer, who's kind of still trapped in the anti-inflammatory space, and there is a need for that, and you want to do it in a way that is least harmful to the body. And my objection with statins is primarily the harm that they do without being powerful anti-inflammatory agents. They're kind of the pimple on the butt of the elephant that is inflammation. But there are far less toxic drugs, far less toxic ways to reduce inflammation. But the best way to do it is to change your behavior and change certain things that we do that induce inflammation. So number one, let's talk about things that cause inflammation. Number one, the most inflammatory thing that the majority of people in the world, not necessarily in America, but the majority of people in the world, where the large populations are, particularly China, Japan, somewhat in India, although India has taken a more proactive stance than the US, and that is the use of nicotine products. And originally, or way back, it was smoking and chewing tobacco and snuff. Well, the tobacco companies have forced that narrative forward, and again, they always minimize, trivialize, and rationalize the inflammatory harm. The inflammatory harm at a biologic level comes from one substance called nicotine. Nicotine. And whether you're vaping, which is the new popular thing, and using that as an anxiolytic to manage emotional need, doesn't matter. But smoking, nicotine, nicotine, nicotine. And you go to Europe, you go to Japan, you go to China, everybody's still smoking. So yeah, in the US, we kind of keep it behind closed doors, but 60% of kids are vaping at high school. And that is a primary, massive, particularly vascular, endothelial, and pulmonary inflammatory product. So the first simplest thing to do is to get rid of nicotine products, not only that you consume, but try to live in an environment where other people are not adding secondhand smoke, secondhand vape to you. Yeah, I said secondhand vape. That's number one. Number two, and I think in the US, this is by far number one, but it certainly parallels or exceeds nicotine. And that is chronically elevated carbohydrate consumption. Chronic excessive carbohydrate consumption. Whether those carbohydrates are directly causing inflammation in the gut, in the liver, and in the bloodstream, because the sugar remains as glucose, fructose, galactose, but primarily glucose and fructose, where the sugars, the glucose and fructose, remain in that space in their current form. Think about this, folks. If you're eating a lot of vegetables, vegetables have cellulose, which is a pro-sugar. It's basically sugar sitting in our gut. And everybody out there tells us fiber and vegetables are so good for us. Well, that's causing acidification of the gut. So there is sugar trapped in vegetables. There is sugar that we're eating. There is sugar going to the liver, fatty liver. Explain that in a second. And then sugar in the bloodstream and sugar in the space between the bloodstream and the cells where the nerves and tendons live. And then sugar inside of your cells. At every level, in every space of the human body, elevated levels of sugar, glucose and fructose predominantly, cause inflammation and trigger the inflammation system. At a simplistic level, sugar sucks water into the cell. So we get swelling of the endothelial cells. In the brain, we get swelling of the brain cells, migraines, tinnitus, all of those things. And if you've got a low salt diet, you're not protecting that fluid shift that is caused by sugar. But sugar also in elevated amounts directly triggers a pro-inflammatory cellular environment. And the majority, in fact, all of the cells in the human body are armed with and geared up to recognize inflammation and then to put the fire out. So while the sugar is the trigger, a large part of the damage occurs in the mismatch between the cellular and external signals that say, hey, there's inflammation going on, and the response or the excessive chronic response of the body to deal with that inflammation. So simplistically put, if you look at any public building, you look at a school, throughout the school there are fire alarms. They're attached to the wall, little things that you can pull if there's a fire. And then there's a sprinkling system and doors that close and all that kind of thing, but a sprinkling system and a whole system to respond to the presence of a fire. Now, those sprinkling systems are not going to respond. The doors aren't going to close. The fire response is not going to happen if there is not an inflammatory trigger or a fire trigger of that system. So if nobody's pulling the fire alarm, if that little bit of liquid isn't expanding to release the water, there's no response. And if there is a fire, so let's say your smoke detector in your house is not working, or your fire detector, the house burns down. So yeah, if there is a lot of inflammation and you don't protect against it, that's awful. But at the same time, if you're in a school and little Johnny runs down the corridor and pulls the fire alarm when there's no fire, and you get this, and everybody's doing that every day, you get this massive response of water coming down, the doors are closing, you get this anti-inflammatory response to the lack of a fire. And when that happens, the body's response to that is way worse or as bad as the inflammation itself. Think that one through. So if the firemen come to your house and the fire is next door, but it's not your house, and they bring an axe and they break down that door and they rush in and they destroy the house and trying to put the fire out because there's an urgency to that, but there's no fire, that is often happening inside your body. So we've got to understand that inflammation is about a call to action and a response. And the call to action should always or preferentially be appropriate to a true problem. So there should be an internal or an external threat that activates the immune system, that activates the inflammatory system. And then there should be an appropriate, short-lived response to that inflammation. And as soon as the inflammation, the insult is dealt with, everything should calm down. So we want to be in a calm state as best as we can be. No inflammation, no inflammatory response. But the system should be ready to go if there's a threat. Now, that is typically and evolutionarily has been designed to deal with an external threat. So, for example, if I cut myself, that is an acute inflammatory response. And if I cut myself, there is a whole response. There's a response that says, dude, you're cut. And then the immune system and the coagulation system come and deal with that cut. And if the cut's a little bit infected, my immune system is there. If the cut is just open, it's an instant clotting cascade and then a delayed healing cascade where you form a scab. First you're bleeding, then you form that serous layer, then you form a scab, and then the scab goes away and you start to infiltrate the scab with muscle cells and with collagen cells and smooth muscle cells and new skin cells, and eventually you're just left with a scar. And the body is healed. Now the scar is going to be there forever, but it'll slowly modify. That is, folks, a healthy inflammatory response. Okay? So my body recognizes I've been cut and it responds to the cut acutely and then slowly over time until it's healed with a scar. That is the healthy process. And the human body ideally is armed with a whole bunch of things that recognize the cut and that can heal the cut. And that is where the problem comes in. This is where the problem comes in. And most of us on a standard American diet with a standard American way of life or UK way of life, whatever your country is, are in a pro-inflammatory, chronic pro-inflammatory environment where we are continuously triggering the inflammatory system, especially on the inside of our bodies. So for example, if you're eating grain products have a bunch of proteins in them that irritate the heck out of the intestine and particularly trigger and arm the immune system in the gut. Okay, so you get this overreaction in the gut, you get inflammation in the gut, you get your irritable bowel syndrome, you get your bloating, you get your cramping, you get gut issues happening. And if genetically those cells overreact and they see something as foreign being similar to something internal, now we've got autoimmune disease. Celiac disease is one of those. It's an overreaction to grain protein, one of the commonest products. If you don't eat grains, you don't have the problem. Okay, you don't have the problem. And then some of those cells cross-react. And for example, the commonest autoimmune disease that I see is thyroid disease, Hashimoto's, occasionally Graves'. There is an autoimmune response by those cells reacting to grain products in the gut that go back and damage or harm or break down the production of thyroid hormone, T4 and T3. There's Hashimoto's. And at first there's a stimulant effect and then a dumbing down effect. Now you're stuck on medication for the rest of your life because you keep triggering that system. Well, guess what? If you eliminate grain products from your diet, slowly over time, that system settles down. And then you don't have the cross reaction. You don't have that aggressive response. Okay? The human body, in a simplistic form, at a cellular level, relies on two long-chain fatty acids, two polyunsaturated fatty acids that are the only two essential fatty acids for the human body. We've got 6 omega fatty acids, which you have to eat, the body cannot produce them, and 3 omega fatty acids. 3 omega fatty acids, which the body has to consume. Now, everybody's obsessed with threes, but the reality is the human body, ideally, the most anti-inflammatory state is a 1-to-1 relationship. Maybe a 2-to-1 or a 3-to-1, but not a 15 to 30 to 1 relationship. Because now you've got all the pro-inflammatory, hey, there's a fire going on here, when there isn't, and a weak responsive system. But those arachidonic acid and DHA, which are instrumentally placed in all cell membranes, one says, is the trigger. One is the fire alarm. Hey, there's inflammation here. And there are certain things that trigger that arachidonic acid response, the 6 omega fatty acid response. And if you've got adequate threes, the threes say, okay, we're going to call in the cavalry, we're going to have this clot happen, we're going to call in the white cells, they're going to calm this down, and the 3 omega fatty acids say, dude, nothing to see here, it's been healed, off you go, let's get back to a quiescent state. Why are the 6s and the 3s so important? Because the 6s occur in our diet. Both of them occur in our diet. We have to consume them. But the 6s go ballistic in seed oils. So we are consuming massive amount of 6 omega fatty acids. So we've got this pro-inflammatory environment that we're creating all the time. And we don't have adequate 3s. We don't eat as much fish. We don't get as much fish oil in. We've got a deficit of 3s and an abundance of 6s in the standard American diet. So we've got this mismatch. We have an overactive system that says there's inflammation. So we've got this constant state of inflammation in every space in the human body. And we don't have the anti-inflammatory cool down, calm down, go back to your barracks soldiers. If on a low carbohydrate, low seed oil diet with higher 3 omega fatty acids and higher protein and fat is very anti-inflammatory. Fat is one of the most anti-inflammatory things we can eat, as are ketones. So if we can recreate, and I hate this word, but recreate an effective ratio, an effective balance between those two by not consuming these and not triggering the system that creates inflammation with that elevated sugar, we don't need to put out the fire. But if your 3 omega fatty acids are good and your ratio is 1-to-1, even if there is a fire, you can put it out. That's the fatty acids. But there are some people out there, like myself, whose bodies can very, very readily handle, and this is the complexity of it, handle sugar. So my liver is very good at turning sugar into fat. That's how I became 300 pounds. I'm obesogenic. So my liver protects me from the damage of sugar, in my bloodstream and in some of my organs by turning sugar into fat. So the ability to gain weight when you're eating a lot of carbohydrates protects you from the damage of sugar. Where someone with diabetes, they can't convert that sugar to fat very readily. That system doesn't function as well. So their liver has more sugar in it, more inflammation of the liver that we can measure. The inflammation coming from the sugar, not necessarily from the fat, but the presence of the fat in the liver, the fatty liver, tells us about the inflammation. And then the sugar goes into the bloodstream. Those elevated levels of sugar are activating the inflammatory system. And if you've got an abundance of 6 omega fatty acids and a deficit of 3, when you activate those 6 omega fatty acids with those chronically elevated levels of sugar, the system goes ballistic and you can't put it out. So you're living in a state of chronic inflammation in your blood vessels and in the interstitium, space between the blood vessels and the cells. And that is where you're getting atherosclerosis, you're getting inflammatory damage to the vascular system, you're getting clotting in your legs, you're having your strokes, you're having your heart attacks, you're having your DVTs, you're having your pulmonary emboli, you're having that pro-inflammatory environment in your blood vessels. And in the interstitial space, you're getting damage from that sugar to your ligaments, to your tendons, and to your nerves, neuropathies of every organ, and ligament and tendon injuries. That's inflammation caused by chronic excessive carbohydrate consumption when you cannot adequately deal with the sugar. But then if you look at someone like myself, I get rid of the sugar very well. I walk past a donut, my blood sugar doesn't go up very much. For transiently, it comes right down because I produce a ton of insulin. So we're going to go down that road. And if I'm continuously triggering insulin, so we've got the hyperglycemics, the diabetics, pro-inflammatory environment, vascular and interstitial. But here's the part that most people don't understand, is that insulin's job is really not primarily to clear sugar. If you're not eating a lot of sugar, as our ancestors didn't, you don't need a lot of insulin. You need a little bit of insulin to manage blood sugar, but that is not the primary response of insulin. Insulin is a primary hormone that regulates a large part of the other products of the inflammatory system. So, for example, cancer is primarily, in large part, an inflammatory disease. It's a pro-inflammatory disease. And insulin regulates, when you're insulin sensitive, insulin regulates that pathway. Insulin regulates the production of steroid hormones that are also anti-inflammatory. Insulin regulates T3 thyroid hormone production, which is an anti-inflammatory hormone. Testosterone is an anti-inflammatory hormone. All of these are anti-inflammatory strategies that insulin is the quarterback of. And if you eat a lot of sugar and starch and you have my genetics, the obesogenic genetics, now you're getting very, very high levels of insulin, and it's perpetual. My levels of insulin are high even when I'm not eating. At least this was when I was fat. And that's called insulin resistance. And insulin resistance means you've got chronically elevated levels of insulin, but it's not effective. It can't do the job it's supposed to be doing. So there's no anti-inflammatory immune surveillance. There's no anti-inflammatory immune surveillance. And if on top of that you're eating the 6 omega fatty acids with your carbohydrates and you're not eating adequate 3s, not only do you have the inflammatory state, of which I don't have a huge amount from the sugar because I'm converting it to fat, and that fat is stable and is anti-inflammatory, but insulin causes inflammation in the liver, the liver doesn't need that to convert sugar, but causes inflammation in the liver, causes inflammation in my fat cells, causes inflammation in every one of my cells as a default, because it's not producing the anti-inflammatory products that ideally I want. So when you're eating a lot of carbohydrates, you can get inflammation in your blood vessels and in the interstitial space based on sugar as a pro-inflammatory molecule. I'm protected from that. So if you're obesogenic, you're going to have normal blood sugars or fairly normal blood sugars. You are not going to be at a risk of a heart attack or those ligament injuries or the tendon injuries. The inflammation happens inside of the cell. Inside of the cell. And in the intracellular environment, that's where insulin regulates the immune system, the immune responses within your cells. And if those cells are in a pro-inflammatory environment because the insulin is not working effectively, it's insulin resistant, you're getting cellular injury, autoimmune disease, Alzheimer's, cancer, the effects of low testosterone in men, the effects of high testosterone, PCOS in women. All of those are pro-inflammatory. Higher uric acid levels, pro-inflammatory. So the two commonest sources of inflammation, nicotine and chronic excessive carbohydrate consumption, where that inflammation occurs inside of cells, of the organ cells, or in the blood vessel space or in the interstitial space, depends on your genetics. But if you can quieten down the inflammatory system, the triggers of the inflammation, by not smoking and not using a lot of carbohydrates, and become insulin sensitive, then it doesn't matter which of those two realms you fall in, the diabesogenic or the obesogenic, the hyperglycemic or the hyperinsulinemic categories. You dumb down the inflammation. And Ben Bickman has done some great work with cells in the laboratory showing the inflammatory response. And in human beings, we look at that inflammatory response all the time. And I look at a variety of different inflammatory markers. I look at your white cells. I look at your eosinophils, your monocytes. I look at your responsiveness in the bloodstream to inflammation. I look at your CRP. I look at your ferritin. I look at a variety of different inflammatory markers. We look at your insulin level. We look at your fasting blood glucose levels. We look at your triglyceride levels. All of those are giving me information about your inflammatory system. And if you do not trigger the inflammatory system, then you don't have to worry about taking a whole bunch of drugs that affect the extent of the inflammatory response. And that's the methodology that we use. Early on, they're fine. But ultimately, the pressure is on you to keep the soldiers quiet. No wars going on here. But you don't want to dumb down that inflammatory response so that if you do cut yourself, you can't respond. So if you think about this, one of the most commonly prescribed medications, apart from the statins, one of the most commonly prescribed appropriate drugs that we use for people with intravascular inflammation are anti-clotting factors. So we've got the factor 10A, the Eliquises, we've got the platelets, the Plavixes, we've got the aspirins. All of those are designed to affect the inflammatory system, the clotting system. Okay? So you reduce clots in your blood vessels in response to the inflammation of the vast vessel that came from sugar or nicotine. But what happens when you cut yourself? Look at the picture that I'm about to show you of a patient of mine on Eliquis who fell, cut his head, should have been a non-issue. Look at the picture. Think about the bruising and everything else that happens because you're on a blood thinner to combat inflammation in your blood vessels, and now you don't have a response going forward. And in the next video that we're going to talk about, the next series of videos, we're going to talk about how dysfunctional the healthcare system has become at treating natural products the body produces in a positive genetic way to deal with inflammation. And what we're doing is dumbing down our healthy inflammatory response with statins and with anticoagulant drugs because we've got a relationship with another drug called carbohydrates that is pro-inflammatory. So we're destroying hundreds of thousands of years of positive evolution to dumb down a maladaptive response. The body is just doing what it's supposed to do. But because of the friendly fire, that's the problem. So you're dumbing down the entire immune system. So you've got more cancer, more Alzheimer's, more other damage to the body because you don't have that response. Instead of putting out the fire, you're destroying the firemen. You're destroying the firemen so that their response in putting out the fire doesn't damage the cells. Why not create a fire? If there are no fires, firemen are just going to be fine. They're going to be driving up and down the road looking for fires. But it's What we're doing is we've said we're going to allow these fires to happen everywhere, but we're going to dumb down the response of the firemen. And you expect to be healthy. That's nuts. My focus on carbohydrate reduction, on seed oil reduction, my focus on nutritional health is to prevent the fires, to kill the arsonist, so that you don't have to deal with the inflammatory response to it. Think that one through, folks. The problem is I don't have a pill for that. I don't have a pill to prevent you from creating the inflammation that your body is appropriately responding to. Think that one through. So if you can follow an anti-inflammatory way of life, diet, you don't need to beat up the system that's there to put out the fires. I am the Carb Addiction Doc. If you want to understand your level of current inflammation and track that over time, we can do the blood work to look at that. But don't buy into all the pills, all the powders, all the potions to put out the inflammatory system and ignore putting out the fire. And if the fire is down, we can measure that. You don't need all this other crap. Set up a visit.